Hello, how are you today? Good, okay. So I understand that you are here for your annual cranial nerve exam checkup. Okay, great. So before we get started, I just want to check that your health or medication or health with any family members hasn't changed since you were last here. Okay, so has any of those things changed since you came here last? Okay, some medication. And what medication is that? Okay, and what do you take that for? What's it prescribed for? Okay. And how many of those are you supposed to take a day? Okay. And do you take that many? Okay. Okay, and no other health changes with you or any family members? No, okay. Okay, that was simple enough. We can just get started. I can see on here that you haven't had any sort of eye check or eye exam since you were here last year. So I think we are going to start with the eyes. Is that okay? Okay, good. So if you could just stare anywhere behind me, please. I'm just going to do a few little checks. Okay. Okay, good job. Now if you could just follow the light for me. Okay, keep following the light, and it doesn't matter if you can't see it anymore, just follow it until you can no longer see it, okay? And then the same back. Good job. Great, the same again. Okay, good job. Now I would like you to do a quick eye chart for me. Okay, so we'll start pretty simple. If you want to start with the third line. Okay, great. The next line, the fourth line. Okay, the fifth line. Brilliant. The next line, the sixth line. Okay, the seventh. Okay, great. The eighth line. Okay, and can you do the ninth line? Perfect. Okay, can you read the lines from 4 to 9 again? But this time I'm going to actually look at your eyes while you do it, okay? Just do it at a normal pace, not too fast. Okay, that's great, perfect. Okay, so I'm just going to do a peripheral vision test now with my fingers instead of the light. I'm just going to stand back a little bit so you've got more room to see. So just tell me when you can no longer see my fingers in your vision, okay? Okay. Great, okay. Now I'd like you to just follow my finger instead of the light. Okay, I'm going to do some quite rapid, quite fast finger movements. I would like you to just follow them as best you can. Okay, and again follow the finger. Okay, brilliant. Next we will move on to something a little bit simple. This is going to be your sense of smell test. Okay, so I've got 4 bottles of senses here, and I'm just going to ask you to smell them and identify them. Okay. Okay. Yep, perfect. Okay. They are going to get a little bit harder as we go along, okay, but nothing too difficult. Yep, spot on. Okay. Yep, it's quite faint, this one. Well done. Yep, you managed to get it. Okay, and then the last one for sense of smell. Okay. So this is the hardest one. The smell's actually quite strong, but it's hard to identify. Another smell, yeah. Well done, yes, that's correct. Okay, so our next test is going to be your face sensitivity, okay? I'm just going to get a glove for this one. Okay. So, you know how this works. I'm going to ask you to close your eyes, and I'm going to just lightly tap or touch different areas of your face, okay? And I would just like you to tell me when you feel them, okay? So if you could close your eyes for me. Okay. Okay. Great. Okay. Yep. Great. Perfect. Awesome. Great. Okay, now I'm going to test some of your facial muscles by asking you to pull a few faces, if you don't mind. So, can you raise your eyebrows for me? Okay, okay, and then a frown. Great. A big smile. Yeah, can you show your teeth? Great. Can you puff out your cheeks? Okay, and then lastly, close your eyes as tight as you can. Okay, that's great. Okay, our last test we're going to do today, because today is a very basic cranial nerve exam, because you had one last year, and you know, medical issues haven't changed in that year. It's just a basic exam today. If for any reason I find something that needs a bit more in-depth examination, then we will take it further. But our last exam today is going to be a hearing test. Okay, so I'm going to ask you to close your eyes again, please, and I'm going to make some sounds in either your left or right ear, and I'd like you to just tell me if it's left or right. Okay, great. Okay. Okay, if you could keep your eyes closed, I'm going to whisper a number, okay, in each ear, and I would like you to tell me what the number is, please. Okay. 2, 9, 5, 3, 11, 8, 4, 2, 12, 14, 7, 1, 20, 30, 5. Okay, great. Again, another, keep your eyes closed. I'm going to either make some noises close to your ear or far away. Okay, I'm going to do each ear separately, and then I'm going to do both together. And I just want you to tell me if it's close or far away. Okay. Okay, that's great. If you just give me a second to write up some notes, okay? Was that exam okay for you today? Yeah. Okay, so everything looks perfectly fine. I have got a slight issue with your hearing test today. Okay, in your in your left ear, sorry, there were quite a few sounds that you missed. Okay, now that could be due to a number of things. It could be due to a lot of earwax in your ear that's clogged up, but it could be to do with a little bit of loss of hearing as well. Okay, so I'm going to refer you to our hearing department here. Okay, they will send you a letter for you to come back and have a bit more of a thorough hearing test. Okay, yeah, and if it is just earwax, then that's their job and their department to sort that out as well. Okay, we're not here for that today. We're just here to do the nerve exam. I wouldn't be too concerned about it until you come for your hearing exam. Okay, it was just a couple that you missed, but I'd like to get it checked out thoroughly just to be sure. Okay, so but everything else was perfectly fine. Okay, so if you want to just wait for a letter from the hearing department, and we'll go from there. Okay, perfect. Yes, it was nice to see you again. Okay, and enjoy the rest of your day.